Hi, everyone. My name is Nancy Sullivan. I'm an assistant professor and the clinical simulation director at the Johns Hopkins University School of Nursing. The topic of today's Sim Talk is the multi-patient simulation experience. After this presentation, my hope is that you and the audience will be able to discuss the perceived deficits in performance in graduating nurses, describe the importance of a multi-patient simulation experience and how it can help transitioning nurses, and design a multi-patient simulation experience for your institution. During this presentation, I will describe an exemplar that was designed for a large nursing program. Because of this, I consistently refer to the participants as students, but please know that this exemplar can be easily modified to meet the needs of your institution, be it academic or practice. So let's begin with my story. And I think you can relate to this story when you think back on your early nursing career, but I'm a new graduate nurse just beginning work. I've gotten report on my patients. I have a lot of work to do. I just want to start working. I just want to start moving. I go into one of my patients' room to begin care, and I get a call from the unit clerk that one of my patients needs something for pain. I get another call that a physician wants to come up to the unit to do a procedure on one of my patients. I get another call that a family member is on the line needing information about their loved one. Sound familiar? It's actually a very typical day, but for me as a new grad, it's a day that's unraveling. I had what I thought was a plan, but now what do I do? Beyond my personal early experience, more recently I've worked in a program with new graduate nurses transitioning into practice, and I saw this same scenario many times. New grads work according to Benner's novice theory. They are driven by context-free rules that are limited and inflexible. Tell me what I need to do and I'll do it. Now, the perceived problems with new graduate nurses have been well documented. When queried, frontline nursing leaders identified over 30 issues with new grads, 5 of which cause a lot of concern. Recognition of changes in patient status, taking initiative, tracking multiple responsibilities, the ability to prioritize and anticipate risk, and delegation of tasks. So is there a solution for the new graduate nurse? We do know that simulation is an effective teaching strategy. In 2014, the NCSBN study showed that students that had up to 50% of their clinical experience substituted with simulation had comparable outcomes to students that had the traditional clinical experience. So we have the data that tells us that we can integrate simulation into our curriculum. Now, I do have to say that we have to be very careful about how we integrate it into the curriculum. It needs to be guided by the NCSBN guidelines and ANASCL standards of best practice. So that sounds like a topic for another Sim Talk, but I digress. Let's go ahead and move forward. So beyond this study, the literature also cites many examples of the effectiveness of simulation on learning outcomes. So is there a simulation strategy we can employ that mimics the clinical environment where the new nurses struggle? And yes, I think there is, providing a multiple patient experience. We can set up scenarios where students have to actually walk through the experience of caring for multiple patients with differing problems and priorities. Patients newly admitted to the nursing unit, post-operative patients, patients presenting with a new fever, patients complaining of pain and nausea. These address the issues that we just talked about: recognition of changes, taking initiative, multiple responsibilities, prioritization, anticipation of risk, delegation. The student must decide where to go first, if something can be delegated, or if a problem, such as a new fever, is a priority that needs attention and should be reported to the provider. As to how to provide this experience, the literature does have discussions about providing the multi-patient experience in many ways. What I would like to do is to discuss an exemplar for providing an effective experience. I'd like to talk to you about how to design an experience where all of your students can walk in the shoes of a nurse providing care to multiple patients. An opportunity where they need to make decisions based on how their patients are presenting and the multiple demands on their time. And although the evidence does say that students can learn a lot in simulation through observation and participating in the debrief, I would suggest that this experience may be more effective when actually performed, rather than just observing and participating in the debrief. So what I will describe is one potential way to stage this experience in a large nursing program that allows everyone to participate. It is resource intensive, but effective and doable if school leadership is supportive. And again, please remember that what I will describe is easily modifiable to meet the needs of your institution. So my solution, or really the solution of the sim team here at the school, is a 2.5-hour experience that consists of a 20-minute pre-brief, a 60-minute scenario, and a 60-minute debrief. And I'll talk about all these component parts in more detail. So let's start with talking about the pre-brief. So it's important that the students understand what the expectations are for this scenario. The expectations are a little different than they are for the single patient scenarios that they typically are participating in. We do want them to recognize changes and respond to changes in patient conditions, but we also want them to focus on how are they going to organize, how are they going to assess, how are they going to organize, how are they going to prioritize, how are they going to delegate, and it's important for them to recognize that going into this experience. We want them to understand what their roles are. And it's also very important for them to understand the role of the facilitator that will be with them. That person has several different roles. That the facilitator is the unit clerk who will call them if a patient is calling out and needs something. The facilitator is the provider if the student wants to call to report something or get new orders. And the facilitator is sometimes also the lab calling with new laboratory values. In the pre-brief, the students get orientation. They get orientation to the room, where the equipment are, where the meds are, where the glucometer is. So we do not want the student to get derailed if they can't find a piece of equipment that they need to have the simulation run smoothly. And then at the end of the pre-brief, we provide them with a report. Very importantly, we record this pre-brief so all the students get the same message. We provide this experience for over 100 students, so we think it's important that they all get the same message, so it is recorded. So let's talk about the 60-minute scenario, which really defines this experience. And the students do experience this sim in twos. There are two roles. There's a bedside nurse and there's a charge nurse. After receiving a report in the pre-brief, the charge nurse leaves the room for 10 minutes. And I'll talk about this in a little bit more detail later, but we run this sim in one large room. So the charge nurse leaves the room for 10 minutes, and the bedside nurse begins care. They do an assessment, they make a plan, they begin to implement their plan. After 10 minutes, the charge nurse comes in, and the bedside nurse can then delegate as appropriate and necessary. The sim continues now and evolves. It continues to flow for about 30 minutes. And after 30 minutes, the facilitator calls time. At that time, the bedside nurse gives report to the charge nurse, and then they switch roles. We have a new bedside nurse and we have a new charge nurse. The new charge nurse again leaves the room for 10 minutes, and the bedside nurse begins care. In this way, both students have an opportunity to assess, plan, implement, and then delegate. I do want to add that after the first 30 minutes of the scenario, the students are told it is 4 hours later. And this is done very purposefully. We want the students to be able to take another set of vital signs if they think it's necessary as part of their assessment. If they have a patient that is in pain, that has gotten medication at the beginning of the scenario, that they can give more medication if it's ordered every 4 hours. And interestingly, one of our patients is a patient that is a rule-out MI that has orders for ECGs and labs every 3 hours. In the second part of the scenario, we are hoping that the students recognize that they should inquire about the second set of the set of ECGs and labs. We have run this scenario several times, and nobody has inquired yet, but we always have hope. So then we move into the debrief, and the debrief is very intensive. It's just the 3 people, the 2 students and the facilitator. And it starts the way debriefs always start. Let's talk about your patients. Why are they in the hospital? What is their diagnosis? What are their comorbidities? Do they have any allergies? What meds are they on? And then we move into, how did your patients present? How did they change? Did any problems come up? And then it moves to, what did you do? How did you respond? How did you prioritize? Why did you prioritize that way? In this way, our hope is that the students leave the debrief with an understanding of what they did well and what they could improve on the next time they are taking care of multiple patients. So let's just spend a little bit of time talking about some operational details for this experience. So first, this experience was conducted in a large room, as I said, in one large practice room. We have practice rooms that have about 12 beds in the room. We spaced the patients around in the room, and then we pulled curtains around the beds to simulate rooms. It's not tremendously good for fidelity, but it does work. You can do this in separate rooms. It does increase the fidelity, but the rooms have to be close enough together so that the students can move from room to room quickly and smoothly so the simulation can run smoothly. As to how the patients are portrayed, we've run this experience several times. The first time we ran it with a mix of mannequins and standardized patients. Using mannequins is a little bit more labor intensive. You need somebody to run the computer and to speak for the mannequin, but it does work. The last couple of times we ran this experience, we used all standardized patients, and which the students love, and it really adds to the fidelity. But you need to remember that if you're going to use standardized patients, you need a very detailed script. The standardized patients need to respond to the evolving scenario. We do not want the standardized patient and the student to go down a rabbit hole. Very importantly, using SPs, standardized patients, they give feedback at the end of the scenario. They can talk about eye contact, communication, caring, and compassion, and the students find that very valuable. They can also provide very concrete feedback. You didn't check my armband, you didn't wash your hands before you came into the room. As to the number of patients, when nurse educators were queried, they suggested a 3-patient scenario, which is what we use. But again, that can be modified to meet the realities of your environment. As to the type of patients, you can use many types of patients with many different priorities: pain, nausea, new admissions, cardiac patients, and a really good patient example to use is a patient that needs discharge teaching. In any hospital setting across the country, due to the very short length of stay on any inpatient unit, there are a number of patients that are going to be discharged that need discharge teaching. So that's a good patient to include in your scenario. In our scenario, we included a patient that was two days post-op from a CABG with a chest tube on the right side, a patient that was a brand new admission from the PACU after knee replacement surgery, and then we had the patient that was a rule-out MI that I talked about earlier that was planned to be discharged the next day. One caution is that when you're choosing patients, avoid an emergency. Avoid a patient that has sudden and severe chest pain and shortness of breath, sudden and severe hypotension, or the student's worst nightmare, a patient that goes into cardiac arrest. That can derail the multiple patient scenario by requiring the student to correctly focus on the emergency, not the multiple patients. Very importantly, our faculty had a full orientation to this simulation. They knew what to expect, and they knew where we wanted the sim to go so that it did not take a right-hand turn and go down into a rabbit hole. Also, our patients were trained in simulation and debriefing. Our faculty were trained in simulation and debriefing. I'll talk very briefly about scheduling, but what happens is what we did was we had 2 facilitators per room, and essentially the facilitators rotated in and out of the room. For instance, facilitator number 1 would go into the large room where we were conducting the sim and run it for the 60 minutes. When they were done, they'd leave and go to a different room for their debriefing. Facilitator number 2 would come into the room with 2 new students, run the sim for an hour. When that facilitator and that sim is done, they'd leave the room to go to another room for debriefing. Facilitator number 1 would come back into the room with 2 new students and run it again. In that way, they would rotate through the room. So again, this experience can be easily modified to meet the needs of your institution, but the takeaway here is that the multi-patient experience is a way to provide an opportunity to address the concerns related to new nursing graduate performance in the clinical environment. The student can walk in the shoes of a nurse, or the new nurse can practice walking safely in their own shoes, thus hopefully easing nursing transition into practice. Thank you very much. It's been a pleasure talking with you, and I hope you have found this sim talk on the multi-patient scenario valuable.